Good afternoon. My name is Mike Chiricos, and I am the radiology manager for the St. Luke's University Health Network in the Monroe region. So basically every place around here that you see with the St. Luke's star on it that has any sort of imaging services, I'm responsible for. So not that I'm going to remember your names, but I would like to just hear them first off. So if you wouldn't mind starting off for me.
My name's Gabby.
Gabby.
Shahid.
Nice to meet you.
Jordan.
You're my javelin thrower, so I'll remember that one. And,
Isabella.
okay.
Obvious.
Nice to meet you.
I'm Ellie.
Okay, wonderful. So what we're going to talk about today, I guess we'll go through the PowerPoint. So a little bit about myself. So like I said, I'm the radiology manager for the Monroe region for St. Luke's. I've been in healthcare since 1997. I started into, right out of high school when I graduated, I went into radiography. I've been an X-ray tech, I've been a CT tech, I've been an MRI tech. MRI is my favorite, by the way. I've been a PACS administrator, I've been a clinical coordinator, and I've been a manager both outside of St. Luke's and now with St. Luke's. I've been with St. Luke's for the past 6 years. When I graduated high school, I started right into the CMC School of Radiology. Are you familiar with Scranton at all a little bit? There's a community medical center. It's Geisinger Community Medical Center now, but at the time it was just community medical center, and they had a 2-year radiography program. It was widely popular. They would only take, it's a 2-year program. They would only take 4 students each year. And my brother went through one of the questions you'll probably ask me at one point is how did I get interested in radiology? My brother had gone through the program. I was a senior in high school. I had really no clue what I was going to do. He said, well, I wanted to come to work and shadow with me for one day. Went to work with him, shadowed for him for a day, found I liked it, and here we are right now. One of the things that was asked is what classes did I find in high school that were probably the most helpful for anything in radiology, so anatomy and physiology. And that is out of, we could talk about physics, we could talk about all things like that. But really, at the end of the day, anatomy and physiology is the one class in radiology that you'll use through your entire career. Physics and all that stuff, after you get your certifications and your boards, you can throw all that away. But anatomy and physiology, you'll use every day of work. Any questions for anyone so far?
Can I ask what PACS stands for?
PACS, Picture Archive and Communication System. So back in 1997 and many years before that, when you would have your X-ray done, you would probably think, they would, you'd take it and you would have a film that you would hold up. And that's, we actually did, you would take a picture on film, it would have to go through developer, fixer, washer, dryer. We had like the old fashioned dark room that we would actually process film in. So fortunately, as time has progressed, all of our imaging has gone digital. We no longer have film. So that the PACS is the computer archiving system that we store our images on, and that like our radiologists and whatnot read them off. Good question. So some of the services I hope you guys can see that pretty good. Some of the things that we're going to talk about today is general X-ray. You'll see in the top left, you see the poor guy with the broken forearm. In the center here, that's what some of our CAT scan images are going to look like. That's brain and nose, kind of your eye area. This is an ultrasound. Bottom right there, or bottom left is, as I said, that's my favorite. That's MRI. And this is a wide variety here. This is nuclear medicine. We have some PET scan imaging and some functional brain imaging. So we'll talk more about that. That's really good stuff. So starting off with X-ray. X-ray is always if you're looking into radiology, X-ray is a perfect starting point for everybody. You get such an exposure to everything that there is to do with healthcare as an X-ray technologist. You're doing general X-rays like the chest X-ray you see in the top left, just you could be doing that in a hospital or an outpatient center. The bottom left of your screen there, you'll see that's called a C-arm. And you can see it's called C-arm because it looks like a big C. And that's an X-ray machine that's used in the OR. So when there's certain procedures like a hip fracture, help I fall and I can't get up, I broken my hip. So they have to do a hip replacement. This is what the doctor just don't open you up and put a hip replacement in. The patient would be laying on the table and this x-ray equipment is hovering over the patient over the area. So the orthopedic surgeon can see how far they're inserting the pin into the person's leg or whatnot. I always say x-ray is, our x-ray techs are like our radiology ninjas. They can do a little bit of everything, and they do a little bit of everything every day. It is I've seen so many x-ray techs that have started off that are hospital presidents now. I've seen x-ray techs that have started off that are physicians now. I've seen x-ray techs start off that are now nurse practitioners, PAs, or switched completely over into nursing. That's why I say it's always such a great starting point, because you're going to have exposure to almost everything that there is in healthcare, and it really can open up some different avenues. That's where I started, and you'll see as you went through. I started off in X-ray, I got interested in CAT scan, from CAT scan over to MRI to PACS, to where I am now. So it's a very good starting point. Any questions about X-ray? No, okay. CAT scan, okay, I couldn't forget, I couldn't pass it up on the top left when I saw the picture. All right, you guys think that's funny? I thought it was kind of funny. No, okay. So CAT scan is fast-paced and is really the most utilized imaging modality or type of imaging that is used today, especially in the hospital centers. You can see this is kind of this is when we take pictures with CAT scan, we're actually taking it kind of like slicing a loaf of bread, a large volume of x-rays, it's a high-tech x-rays, and it's kind of just slicing it like a loaf of bread, and then we could reformat it into any direction or any plane that we want to. CAT scan is fast-paced, and it generates the images very quickly. So from the time that the person comes into our department, the CAT scan itself could take a matter of 30 seconds. So emergency medicine, ED, that is CAT scan is a choice, because they're getting so much information on their patient, and they're getting in seconds. That is probably, if you wanted to look at something that has, you're not going to have problem finding like employment after you finish school, CAT scan technologists are in demand. I'm always looking for more techs. I'm always hiring more techs. It's a highly utilized department. Any questions about CAT scan? Okay. Ultrasound. So things about ultrasound. I will tell you, ultrasound is the one modality of all that I wish I had learned. I still find that one, ultrasound is the most technologist dependent. So you're the ultrasound technologist. That is the one imaging modality that is 100% dependent on what your skill level is. The doctors are reading these ultrasounds through your eyes. So what they're looking for, the quality of the images, is solely dependent on you. So the great ultrasound technologists are in high demand. You can see the one, you think ultrasound, what do you think? You think of getting, ultrasounds of pregnant women and babies. Obviously that's not a real baby, but I thought it looked pretty funny. It's not as fast as imaging as, say, something like a CAT scan, but the primary benefit with ultrasound is that there is no x-rays with it. There's no radiation. That's why we could easily scan a pregnant woman, because there's no chance of any harm to the fetus from any sort of x-rays. Some of the non-traditional options for ultrasound, there is musculoskeletal ultrasound. There's certifications just for learning how to scan joints, knees, wrists. Maternal family medicine, there's a particular certifications just for maternal family medicine. An offshoot of general diagnostic ultrasound is vascular imaging. And vascular imaging is just what it sounds like. It's looking at the vessels in your neck and the vessels in your arms, your legs, your abdomen. That's a highly specialized branch of ultrasound. Again, and I'm talking about we need very good ultrasound techs. Vascular takes it up to the next level. But strong vascular techs, high demand, and it is one of the higher salaries for ultrasound imaging. Any questions there? Okay. So moving over to my favorite, MRI. So as I told you, I started off in X-ray, then I went into CAT scan, and then I started into MRI. And I was an MRI tech for 18 years. And I still do MRI now. Every now and again, I'll step away from my day-to-day role, and I'll go back and just work with our MRI techs. I just really enjoy MRI. I really can't tell you, is it the detail of the anatomy of the pictures or the images that we get? Is it the direct patient contact of helping them get through the exams? The intricacies of adjusting sequence parameters to get perfect pictures. I really can't tell you which part about it is that I just really like MRI. So MRI uses essentially radio frequency, the water that's in your body, because you guys we're in that physiology class, so you guys know you're made up of a lot of water. Uses radio frequency, the water in your body, and a giant magnet to generate images. And it's the loudest modality that we do, because when it's taking pictures, it's making the gradients that make you that help us generate the pictures or turning on or off, makes a lot of loud clicking noises. But it provides probably the most detail out of all the imaging modalities. Sports injuries. See, this a picture we have here, a stock picture. That's they're imaging the person's knee right here. That's what we'll take the picture. That's okay. And spine, looking at any herniated discs in the spine, imaging of the brain, functional imaging of the brain. There's particular types of scans that we could do for the brain. If someone has a stroke or a brain tumor and they need to see the location of the tumor and what functions. If we take that tumor out, what functions is that person going to lose? Is there potential that they're going to lose function? And there's a visual stimulation or physical stimulation. Could be just a matter of while they're taking the images, you touch the person's hand, and that area of the brain will start to actually light up. So you can see, all right, so if we're going to operate on this tumor, what is going to be, other than, yes, we need to get the tumor out, but what might be the side effects afterwards? There's pretty much every part of the body can be imaged. There's particular cardiac imaging, particular heart imaging that you can do, vessel mapping of the entire body. Definitely my favorite. Any questions about MRI?
Do you guys for MRI just analyze images and make sure you know how to work the machine?
Yes. So the person that will ultimately read the image is going to be the radiologist. The radiologist is the subspecialty for a physician. Their sole goal, theirs is interpreting diagnostic imaging. Now, from the technologist perspective, what we're doing is we have a certain, depending on the type of anatomy or the body part we're looking at, we have a standard group of sequences, type of pictures that we're going to do. And we adjust the parameters of the system to make sure that sequence comes out looking the way it should technically for the doctor. Now, what we're looking at the image too is, one, we're checking it for image quality. Two, like I said, while we're not physicians, there is a degree of, if there's something grossly abnormal that we're able to see and identify, and we want to make sure that gets in front of a doctor as fast as possible so they can be treated. So a little bit of everything with that. It's a good question. Anything else about MRI? Magnetic resonance imaging. So that's what we talked about, where the three things were: the machine's a big magnet, and we're using basically the radio frequency in the water in your body. So what happens is the MRI magnet is always on, even when you don't hear the machine making noise. The magnet, as soon as from the day we install it in the hospital, the magnet is ramped up and it's on 24 hours a day, 7 days a week. So what happens is that your body slides into the magnet and your protons will align in one direction. You don't feel that, obviously, but you'll feel the protons aligning in one direction. Where the radio frequency comes in, and they're aligning in one direction because of the magnet. So what happens is where the radio frequency comes in is the machine introduces the radio frequencies, and it moves your protons in another direction. And as they start to come back, they are actually emitting a signal. And this here, this is called that's called a coil. It's a receiver coil, and you put the receiver coil around the area that we want to take the picture of. And what the receiver coil is just acts like a big antenna. It receives that signal from the protons, sends that signal back to the computer that's within the machine, and what turns out to be a bunch of little dots and code and signal will turn up to look like an image like that at the end of the day. The first MRIs, if you think about it, MRI is not really that old of an imaging modality. It's really started in the mid to late 70s. It started to become available commercially for imaging in the mid 1980s. So it's really not that old of an imaging modality. Give you an example, just like the progressions of technology. The first MRI of the brain in clinical use in, say, 1985 took about an hour and a half. Right now, we can, if you were to come to the MRI system at Monroe, we could have your brain done in 12 minutes. So, and that machine there is 6 years old right now. It's the medical equipment is coming out, makes advances every year. So, any other questions about MRI? All good questions. Great, thank you. So this one we'll talk about nuclear medicine a little bit. There's a lot of different applications for nuclear medicines. So what we talked about so far with MRI, with X-ray, and with CT, and with ultrasound, is we're taking static images. So what I mean by static is when we take the picture, you see the bone. The bone's not moving, you just see the picture of the bone. When we do the MRI of the brain, you see the image of the brain. You don't see any function of the brain, you just see the brain. If there's something abnormal there, they can see it, but you don't see any function to it. Nuclear medicine is functional imaging. You can see in the picture itself here, just to a degree between these two here, like if you go back to the MRI, if you look close, you can see a lot of detail in this picture. All right, there's a lot of, it's very concise, there's a lot of detail there. If you look here, it's a bit, for lack of a better term, it's a bit fuzzy. It's a bit unclear. What we're not particularly looking for the anatomical detail like we see in MRI and CAT scan. What we're looking for is function. So what happens is the nuclear medicine technologist will take the patient and we inject them with what's called a radioactive isotope. So it is a form of radiation, it's a tracer. And sometimes for PET imaging, it's actually the radioactive isotope and it's basically mixed in with sugar water. And once it's injected into your system, what the camera is doing, and this is the NucMed camera, that would be the table, this is the camera here. What the camera is doing is, so that the radioactive isotope goes into your body and the different organs pull up that are absorbing that blood, how they process that isotope is how they're going to show up on the picture. So this one here, so that's where you're seeing you're seeing essentially in this case, it will be a cancer, unfortunately. You'll see the organs that are processed, that are uptaking that isotope into the cancer. And so this is, you can see these dark areas right here. This is on a PET scan. That's all active cancers, unfortunately. And you can see this program, just in particular, having gone through, I wanted to find a good pre and post. Having gone through 2 cycles of chemotherapy, you can see in this area here, a lot of the bone metastasis and tumors have drastically shrunken. But that's the main thing with nuclear medicine. It's seeing more of the function of the organ and with the blood flow going into it, not just taking a static picture of it. You've heard me say PET scan and show PET scan imaging for you right now. That's a subspecialty of nuclear medicine. It is the the gold standard per se for cancer detection. You'll often see a CAT scan or an MRI, and then if they really want to, if they want to see has the cancer worked its way into the lymph nodes. The main way we may see on the CAT scan or MRI, we may see what looks like a mass, or we'll see swelling. The PET scan, those active lymph nodes, will take the isotope in, so we'll be able to see them right away. It's the slowest of our imaging modalities. You know, all the other ones we've kind of talked about, MRI being a little slower, the other one's a little more fast-paced, a little more active. The images are taken very quickly. Typically, scans like this, you're injected with the isotope, you'll probably sit for 20 minutes to an hour to let it circulate through your system. And then the actual imaging itself might take around 20 minutes. So it's a bit longer of a process. But that being said, the information that our doctors get from that is very important. Any questions about nuclear medicine? Okay. So future career paths, like I said to you, with radiology, even just in starting off with X-ray, you are exposing yourself to pretty much everything that there is to do in healthcare. So while you may start off on this path, you're getting exposed to something else. And then when you do that, you may get exposed to another field that you like. So it does open yourself up to many different opportunities. The one thing I will tell you that we are very proud of in radiology is really there's probably not a person that comes through our emergency room or that gets admitted into the hospital that radiology doesn't have contact with. We play a role in the care of pretty much everybody that comes through that door. It's very rare that we don't do some sort of imaging or we're not part of their care plan in some point in time. So I really like that because that's important for our staff to know. It's like, we make a difference in the treatment of every patient that's in that hospital we touch. And I like to talk about a lot of different career opportunities, and as we talked about the difference in timeframes, like in MRI, the technology is constantly improving. And I think that was the last thing I have, and that's it.
So just to clarify, like with your degree, you are able to bounce around from X-ray tech to CT. Like, is that an easy transition from one to the other, or does it require?
That's a good question. So starting off with radiology and imaging, what you could do you'll do a 2 or 4 year degree program. Northampton offers a fantastic 2-year program. The next closest is Johnson College. They have a fantastic 2-year program. The closest 4-year program, I believe, is Misericordia. Benefits 2-year to 4-year. The benefit to a 2-year, 2 years. That is a benefit, and you're into the work. You can start your career right after that. Benefits with the 4-year program, of course. Trust me, guys, it's never a bad thing to have your degree. You know what I mean? The one part of the slide that I'm working on, I'm 45 years old right now, and I'm working on my master's degree. It's much easier to do when you're younger. But so you'll start off. Let's say you're going to be an X-ray tech. Once you finish your 2-year program, you'll do a state license. It's basically a board review. Then you'll be certified to do X-ray. And then if you see another modality that you start liking CT or X-ray, then there's different licenses for each of those.
So is there, and maybe you're going to say this, but is there then like an advantage from the get-go to getting a 4-year? Like, is there something that you can't do with a 2-year degree that you can do with a 4-year degree right out of the gate?
No, there's really not much difference right out the gate what you couldn't do with one versus the other. I found students that have gone through like a 4-year degree program, they have a little bit more exposure they've spent a little more clinical time, a little more classroom time. But as far as quality of technologists right out of school, I will say it depends on the individual, and how much you apply yourself. Yeah. There's the 2-year programs are fantastic. You'll come out with an associate's degree. And then you could, you'll start to just have more experience and more exposure. You may radiology or just X-ray in general, maybe what you like to do. But then for the most part, I'll tell you, most students are usually doing X-ray for their first year or two, and then they're already looking, all right, I want to cross-train over into MRI, I want to cross-train over into CT. Any other questions?
As far as St. Luke's goes, like if they were hired, like right out of school, like is there like a training period or something? Or like are you kind of like given some kind of like orientation period that you would work with someone? Like
Sure, of course. Well, a couple of great things if you were to be hired at St. Luke's. Any of the Northampton programs, Johnson College, you're going to do almost a full 2 years of clinical training, and you're going to do, and we have relationships with all those with those schools, so you're going to do most of your clinical training at a St. Luke's site. So by the time you graduate, most of those techs, and that's what I'll tell the students when I have them there. So right now is just such a critical time for you. The more you learn, the more you absorb, the more you put yourself into this right now. When you graduate and you pass your boards, while you can still pre-vise with something, but the more you do as a student, you're going to jump right in as a professional tech at that point. It is so like any other job, you're going to typically you have like a 90-day period where you're orientating. Usually we put you right in with the pre-visor. That's the person that you're going to kind of like stick to their hip for the 90 days, so you get to learn the system and how our processes. But you do spend a lot of clinical time, a lot of patient time as a student. So when you jump in as a technologist, you have a lot of knowledge base already behind you.
as far as like continuing, oh, I'm sorry.
Are there any like misconceptions you face as like with radiology, that people might not know how diverse it is or what they do is?
I'd say the answer is yes. Some of the I don't think people will understand the intricacies what the technologist does on a daily basis until they actually come in and they start talking to the techs, and the techs are telling them about, okay, we don't just bring you in, or lay down, hold still, we're going to take a picture. We explain the entire process to the patient, what they're going to experience, if they have any problems or if they're uncomfortable. We make sure we establish a relationship with the patient and explain every little detail about the process, what to expect during and after the procedures that we do. Because some are a little more complex than just having like a chest X-ray done. And usually those are the times in the patients when we're talking about like, oh, wow, I didn't realize that you guys did so much. I didn't realize there was so much detail involved in this.
As far as continuing education, like do you have to maintain certain like continuing ed credits like over a certain period of time or
Yeah,
anything like that?
another excellent question. So when you once you pass your certification and you're certified in either X-ray, CT, MR, most are certified with the American Registry of Radiology Technologists, and you have what's called your 2-year biennium period, and essentially you have to have 24 credits over each of those 2-year periods, and they're very helpful too, because it keeps you up to date on the newest technology, new procedures, and it's really stuff that you're going to utilize on a day-to-day basis.
And if you, let's say, wanted to work in Pennsylvania and then you decided, I really want to get a job in New Jersey, is it as simple as just reapplying for a new license in a different state, or sometimes you have to take like a new test to get licensed in the new state?
So most states, if you're just certified under the ARRT, as I mentioned, you're not going to need an additional license. There are certain states, such as New Jersey, that will require an additional license. Now, if you're already certified like I am in Pennsylvania, and I actually have my New Jersey license, it's not like you have to take another test. Essentially, they recognize the fact that you're already registered through a nationally accredited organization. Essentially, you pay them a fee and they give you the license. But there will be certain states if you're to travel and you just have to have a license for that state, but it's not like you would have to take any additional testing. They recognize the fact that you're nationally certified and you just have to have a license for that state.
So for like a regular day-to-day, I know that like if you're in the hospital, obviously things are gonna be a little bit different, but if you're working like in an outpatient center, as far as like a regular day, like can you just explain to them like a regular like time frame of like hours traditionally that they would work and that kind of?
So typically, in say, a hospital obviously is open 24 hours a day, 7 days a week. And all of radiology needs to be present 24 hours a day, 7 days a week. The only modality that isn't often there the entire time is MRI, and sometimes ultrasound isn't there the entire time. And nuclear medicine isn't there the entire time. And the reason why they're not often there, or they may be on call, is because they're not the first modality that, say, like an emergency department physician would use in a critical situation. The first modality that they're going to use is going to be CAT scan or X-ray. So we need to make sure that that's staffed around the clock. Outpatient centers is more along the 9 to 5 route, for lack of a better term. Typically, there's going to be usually a day shift, and then we'll sprinkle over into the second shift. Can go to typically maybe 6 o'clock at night, depending on the demand in the area. It could go as late as I've worked at outpatient centers before where we were open until about 11 o'clock at night. And those are just scheduled imaging tests that patients, they're busy. The patients, you guys have lives too. You're working or whatnot. You can't get there during the day, so we have availability in the evenings for them. Typical day for most all types of imaging is, you're going to have in an outpatient center or outpatient setting, you're going to have a schedule of patients that you're to do that day. And the most important thing starting off your day is going through each of those patients' charts, making sure that we're not applying, say, a routine protocol to a patient that might require an exam that's going to be a little more detailed than we would on a routine basis. So just really looking at each patient, see what that study is going to require and what changes we need to maximize that. Our day is really spent a lot of patient contact, making sure our patients are comfortable, making sure they understand their procedures, what to expect, how long it's going to take for it to be read afterwards. A lot of time working directly with the physicians, either usually the radiologists, talking about what we see on images, what we could do to help them see what they need to see as far as the doctor that's going to read it.
Any other questions you guys can think of? And then is there just anything that you may be able to comment on in terms of a radiologist? Like I know that's the doctor,
Yes.
but like can you give them any kind of knowledge about, they know like the pathway to becoming a doctor and stuff like that, but
Yes.
maybe just a little bit about that, if you can share anything?
So you said, the pathway of becoming a physician, it is the subspecialty for the physician. What I would say for the radiologist is you may not have all of the patient contact that you would as perhaps like a family physician or an ED physician or an orthopedic surgeon, because you have to realize the radiologist is going to be usually in a separate, secluded area away from everyone else, typically in a darker room, a room much smaller than this. Usually the rooms are about 8 by 10, darker area. They're going to have probably 5 to 6 monitors like this, except a little bit taller, because remember we talked about the images are digital now, and they need to be free from distraction so they could be spending that detailed time interpreting every one of those studies coming through. It takes a radiologist takes someone that really has a fine eye for detail and to look through every image for very small abnormalities or very subtle changes. And like I said, you're not going to have as much, to be very honest, you're not going to have as much patient contact. If that's something, if you're looking into healthcare and you want to have a lot of patient contact or be a physician and be involved in direct care, radiologist is probably not going, you're directly involved in their care, you're reading their images. You're just not going to have a lot of that face-to-face time that you would in some of the other.
And they would be reading all kinds of scans at the same time, or is there one radiologist that's like primarily like CT and MRI, they do it all? Yeah,
pretty much every radiologist is going to read everything. but you are going to, you can do subspecialties. A lot of like women's imaging is a subspecialty. We have a group of radiologists that all they do will read mammography, breast imaging, and that is some of the studies that we talk about looking for subtle changes in details. That is a service there, women's imaging, that requires a very keen eye. So we want them doing them all the time. They stay the most proficient in them. Pediatric radiologists, they can subspecialty into pediatric imaging. They tend to have a little bit more face time because usually when there's pediatric imaging involved, they actually have to be involved in the actual procedure itself.
Any other questions, guys, that you can think of, or anything else you want to know?
If you are looking into, if healthcare is something that you're thinking of, and for the moment right out of the gate, you're thinking 2-year degree versus 4-year degree, whatever your situation is best for you. I will tell you, if you're looking to get into healthcare, a 2-year program through someone like Northampton, it does open so many doors for you. Like I said, you'll get into healthcare at that point and just be so exposed to so many different things. It really will just be the start of your career.
And if they did choose a 2-year, would St. Luke's contribute towards them going back for a 4-year degree?
We do actually. St. Luke's and so we have a tuition reimbursement program for all of our full-time and part-time staff. And if nursing was something that you were interested in, the St. Luke's School of Nursing, as long as you could be an employed PCA at that time, St. Luke's actually covers your full tuition for the St. Luke's School of Nursing.
For like the reimbursement thing for the staff, does it take away from like their salary?
No, that's one of the benefits of being an employee.
Do you usually have like a commitment or something like that to
Typically
stay?
just say that there is a commitment to it, and it is typically just 1 year after completion.
As most things
It's
would
fairly
be.
standard,
Yeah.
yeah.
Makes sense.